I'm going to take you into a very different world, a world of the very smallest humans and what it means for healthcare and what it means for the rest of us. I'm a data scientist, as it's known now, computer scientist by training, and in the last 15 years I've been redirecting my energies to not just help in banking and retail and finance, but to come up with new approaches to healthcare. Premature birth is an increasing challenge for a number of reasons I won't go into now, but babies can be born 17 weeks early and still have an opportunity to survive, and their organs aren't developed, so they need to continue their development outside of the womb. So in my research, we're trying to utilise every single piece of data that comes from these medical devices, rather than just using it to see in that moment is the baby still alive, and to record summary information just every hour. We're trying to use every single piece of information from this plethora of devices. Though that means that we are analysing more than 1,200 readings every second. And when we start analysing the brain, it'll be more than 10,000 just for the brain, and then an extra 1,200 of what we're already doing. So why are we doing this? Late onset neonatal sepsis is a form of infection, and it can kill these tiny babies. Now, what I've shown you there is 2 volumes. The one on the left is 40 mils of blood. That's how much blood a premature baby has in their whole body, because no matter what size you are as a human, you have 80 mils of blood per kilogram, and they're half a kilogram. The vials on the right represent 5 mils of blood. So the doctors take 5 mils of blood, 2 mils of blood. They take 2 mils of blood if they suspect it's infection. And then 2 days later, they have to take another 2 mils of blood. So they take 5 and then 10% of their blood volume just to discover if there had infection. And they don't start making blood for 1 to 2 months. So I want to just skip forward a minute to the types of innovations we've given them to understand physiology. The device on the left, 15 years old, device on the right is the type of device they have in critical care today. We've made great advancements to help them to try and provide better care to patients. We've given them colour, and we've taken the signal from analogue to digital. What does that matter to a doctor? And yes, the colour is helpful, but we're not answering questions. We're not telling them, is a baby becoming infected? We're not telling them that they're getting too much oxygen so they can have the problem of Stevie Wonder, who was born premature, and the reason he's blind is that he received too much oxygen as he was going through that prematurity stage. We have all these devices. We're coming up with some great technologies to give us more numbers. But what do the numbers mean? And how can we use them? So, as a computer scientist, I realised that we systemically were missing a piece in the puzzle. We were missing the piece that gave them a platform to be able to analyse all of this data. So that's been the focus of my research. And when we do that, and we allow them to do that, and if this chart represents hourly metrics for the baby, and the blue is good, the yellow is not so great, and the red is certainly becoming significant problems, as is the pink, you can see in the time continuum that in these last 12 to 15 hours or so, that there is a significant problem. And if I told you they only picked it up at the bedside the second hour in from the right, you'll start to see why looking at every breath and every heartbeat becomes significantly important, and why these types of systemic platforms will change healthcare and be as disruptive as all of the genomics research that's being proposed. We also have these new ideas about telehealth and telemedicine, and they were innovative in 1924. I'm sorry, burst that bubble. But we still haven't provided a good solution to be able to monitor people in a non-invasive way and make sense of the data for meaning, for health and for wellness. This is one of my collaborative partners, former astronaut Dave Williams, one of the Canadian astronauts. And this is the type of thing that he needed to do on the space station to be able to monitor the changing behaviour of the body when you go into space. And what I'm trying to now do with my research, similarly to monitoring the adaptation of a baby when it's born too early and its body's needing to develop outside of the womb, we're using the same technology now to monitor astronauts, and we'll be starting to collect data for that in the coming months, so that we can start to show that we can assist in monitoring every breath and every heartbeat, not just for those on the International Space Station, but ultimately for those who go on the mission to Mars, because that'll be a 500-day mission. I won't go into the details here, but we need to give them an autonomous system. That's what you see on the top of the screen. That essentially is that tricorder. We're working on the technology and the intelligence to go into those type of systems, and they can pull the data down to mission control when they have contact with Earth. But beyond that, beyond just monitoring astronauts and babies, I've now diverted my energies in a different area, would you believe, to monitor tactical operators, SWAT teams. If their heart rate goes too high, they have tunnel vision, they can pass out. We need to ensure that these operators are trained to manage their own physiology. So in the same way, and using the same technologies of this big data and monitoring physiology, I now, instead of giving them just an environment where they can work with virtual reality and go through games to train in how to do building clearing, we can now monitor their physiology. But we go one step further. This is a haptic garment that's a newly developed garment. They can feel in the game, thankfully not completely realistically. They can feel the pressure of the weapon fire, they can feel when they're hit, and they can also feel the hands, the shoulder squeezes and other gestures. So they can feel the activities of the game. We monitor their physiology. We monitor as they go through that simulated activity of room clearing, building clearing. How do they behave? Do they remember to breathe? These are things they haven't been able to do before. We can do that with these new type of technologies. So my research since moving from Australia in 2007 has expanded on many levels. I've been able to extend the architecture, move it into a cloud, work with a number of partners, work on very new different styles of analytics, work with lots of different devices, and move the research into a number of different areas. This is the new face of healthcare, and in partnership with genomics, for every individual using Fitbits and other personalised devices, the way forward will be that you can manage your own health and wellness, and we're building those platforms and tools to do it. And we have had very fortunate, I just want to acknowledge the funding that I've had from Australia, United States, Canada and China for this work. And my team is international as well as interdisciplinary. And in this type of research, as has come up a number of times today, you need to bring people together from all those different areas to be able to come up with these new and innovative approaches to healthcare. So thank you very much.